Hi, my name is Yvonne Stubbs, and I'm an oncology nurse educator. So what is an oncology nurse educator? Well, what my role is I talk to other healthcare professionals and educate them on treatment therapies for patients that have a cancer diagnosis. Right now, I work with those healthcare professionals that take care of patients with prostate cancer. So how did I become an oncology nurse educator? It's a long story, but I started out in high school, in an inner city high school in Pittsburgh, Pennsylvania. And I was in a very small inner city school where students that looked like me were not destined according to the teachers and some of the other professionals in that school. We were not destined to be very successful. But out of that inner city school, people that looked like me, we had judges, we had lawyers, we had nurses, we had nurse anesthetists, we had CEOs of companies, and we had people that own their own auto businesses. So we proved them wrong. When I was in high school, I was in a biology class, and in that biology class, we dissected a pig. And when I dissected that pig, I was so intrigued and so interested in all the parts of this pig and the closeness of those same parts to the human body that I said, okay, I want to do something that has to do with the body, something that has to do with taking care of people. And so I thought, I want to be a nurse. I graduated from high school and I went to the University of Pittsburgh and for 4 years and got my bachelor's degree. So I graduated, took my license for nursing and became a registered nurse. The only way you can become a registered nurse is if you have either an associate's degree or a bachelor's degree. About 6 years ago, I decided that in addition to having my bachelor's degree, that I really wanted to have a higher level degree. I had thought about that many years ago, but decided not to at that time. But about 6 years ago, I decided that in order for me to really be respected in an education role, that I should have a higher degree of education myself. So I went back to Jacksonville University and I got my master's degree in nursing. So I have a master's of science degree in nursing as well. And that was an additional 18 months that it took to get that. That was in leadership. So I have a master's in leadership of nursing. I had so many people that helped me along the way. There was one nursing professor that was there and she told me, you have learned everything in this 4 years. When you leave this campus, do not set boundaries for yourself. Do not limit yourself to just being in one area of nursing. There are so many doors and so many opportunities for you that you can do whatever you want in nursing. And I was exposed in college to IT back when, we barely had, we didn't have laptops, of course. We had these big computers and we had what they called CPU systems. So it wasn't as common as it is now. So I was exposed to that then. I was exposed to legal nursing. I was exposed to all aspects of nursing and even leadership roles in nursing. So I always knew that there was a lot of things that I could do. But when I graduated, I worked on an oncology nursing floor, so taking care of cancer patients. And I did that for about a year, and I said, you know what, I need to know more about what's going on with my patients. I want to know more. So that fueled my desire to look for another area. So I ended up going into critical care, and that's taking care of patients that are in the ICU. And I did that for many years. And life happened. I got married. I had children. And I went back to oncology nursing just because I thought, well, these are great hours. I'll go back to oncology nursing. So I went back to oncology nursing. But again, I had this desire to learn more, to do more. And I ended up becoming the educator of the Cancer Institute that I worked at. And so I educated other staff nurses, and I also started a community program where I would go out into the community and partner with other organizations in the community so that we can get information out to people in the community about cancer, about their diseases, and how to get screenings, and how to actually take care of the cancer diagnosis once they're diagnosed, what treatments that they could use. I was exposed to many salespeople that came in from pharmaceutical companies that would come in whenever there was a new drug development that was a new therapy for our patients. And I built several relationships with those people. And I thought, you know, I think I want to do education for that industry. So about 6 years ago, I decided that that's what I wanted to do. I had an opportunity to become a nurse educator for a pharmaceutical company, and I became that nurse educator for that pharmaceutical company. Has many, many perks. I'm so glad that I did that. I always loved traveling and meeting people and seeing different things, as well as education. So working in the pharmaceutical industry allowed me to do that. So as a nurse educator for the pharmaceutical industry, I go to many different cities. I travel a lot. I've traveled as far as Spain to represent the company in Spain at a conference. And right now I cover several states. So I cover the state of Florida, I cover Alabama, and I cover Georgia. But I have covered as many as 5 states at a time. So I would travel to North Carolina, South Carolina, Georgia, Florida, Alabama. I would cover that southeast area. And so I would travel to the different hospitals and the different doctor's offices in these areas, and I would educate the staff on the treatment for those patients that have prostate cancer. And so I love it. Because I do what I do, and because now that I'm in the industry, the pharmaceutical industry, I am able to still impact the lives of many, many patients, because that is what it's all about for me. So if I can bring new therapies or bring the information about new therapies to these different healthcare professionals and make sure that they are delivering the therapies in the correct way so the patient gets the full benefit of those therapies, and that those patients can possibly live longer with their cancer diagnosis, or they can possibly have a cure. Not all cancers are cured, but if we can extend the length of time that they live a fulfilled life, that's important to me. And so being an oncology nurse educator, I'm able to make sure that patients get those benefits, right? Because if the healthcare professional is delivering that medicine the right way, if they are giving the medicine to the patient at the right time, they are delivering it the way it's supposed to be delivered, whether it's they take a pill or whether it's given through an IV. If I can educate them and make sure that they understand completely how the drug works and how it can benefit their patients and what to look for in their patients, if there should be any effects from the medication, then I feel like I have impacted those patients' lives. And so I have come full circle. So from being on an oncology floor to working in the ICU to doing travel nursing. I don't even know if I mentioned that, but doing travel nursing, and now doing education for an industry where I can still travel is a plus for me. The other side of it is that, of course, besides the perks of traveling to all these different cities and meeting many people, you get paid very well. So, this is an industry where you can make a lot of money doing what I do. You can make well into the six figures doing what I do. And like I said, it's very fulfilling for me, and I hope that if you decide to go into nursing, that you will always remember that there are many opportunities in nursing, and never limit yourself. Always continue to grow and learn, and find somebody that can help guide you along the way and just mentor you and pull you in and help you get to where you want to be. And I think you will be fulfilled.